Yes, I can start, right?
Namaste, sir. This is Yashasvita from Panchajanya, Ahilya Bai Wing. Panchajanya, the divine conch of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in mind, our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. All this while walking in the path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. The founders of this organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharatarashtra, and values to all Shastra of people in every corner of the world. Also, the founders, being Ayurveda aspirants, know the inside out of today's medical field. Hence, they aim to provide people aware of this and also try their best to solve this on the go. This is an organization that is created by 28 young, energetic individuals of the 21st century, where all have left behind differences, insecurities, and have come together united for the betterment of this great nation and its heritage as a whole. We at Panchajanya recognize each and every individual's true potential and make sure they reach their maximum. Everyone who is part of this family performs on their own will, but within the limits of service and contribution. When one becomes part of this organization, he or she will surely feel proud and honored when carrying out the activities. Weaknesses become strength when all are united in the process of progress. In the process of doing good for the society, and that's how the environment is at Panchajanya. No one is considered superior or inferior to any, and all will get a chance to show their interest. Our main goal is to reach every individual in creating awareness of our ancient knowledge and wisdom, its efficacy in the modern era, and link with current ongoing affairs. Its revival and most importantly, bringing everyone together in working systems, establishing a strong system. In order to favor all these to be achieved, we have set up various wings with working places and objectives that help achieve the goals faster. They are Ahilya Bai Wing, Swami Vivekananda Wing, Karnata Bala Wing, Govardhana Wing, Ashwini's Wing, Narada Wing, Kautilya Wing, Vedavyasa Wing, Nalanda Wing, and Sanjaya Wing. Coming back to the members involved in our organization, we have doctors, healthcare workers, teachers, students, and people from almost every single occupation available aiming at working together and bringing forward the true essence of Bharat and her traditions. So, all those who fit under these categories are welcome with honor and privilege. Today's session, the session 5, is by Dr. Yogesh Acharya, MD Ayurveda, UG from Sri Dharmasthala Manjunatheshwara College of Ayurveda, Udupi, and post-graduation in Kaya Chikitsa from Sri Dharmasthala Manjunatheshwara College of Ayurveda, Udupi. Since last 12 years, Sir has been working as a faculty in the Department of Swastha Vritta in STM College of Ayurveda. We Panchajanya team welcome you, sir. Over to you, sir.
Okay. Thank you. So this is an the wonderful area where we are starting with an exam orientation or training. So that's a wonderful. So I will directly come to the my point or the my concept. What is given? There is a concept for this particular program. So myself, Dr. Yogesh Acharya, is an associate professor, Department of PG Studies in Swastavartha from STM College of Ayurveda and Hospital, Udupi. So I will start with directly. So today I have the 3 points has to be discussed. So that is, one is the school health services, the first one. Second one is the non-communicable diseases, is the second point. And the third point is Apadravya Nirmulana. That is also having another name in the syllabus. That is a refuse disposal or else the solid waste disposal. So in this three points are concerned, I am not going in detail regarding what you are teaching in the classroom. Here will go to highlight those points which are possible asking in exam. It may be related to the theory exam, or it may be related to the practical exam, or it may be related to the Viva examination. So what are the possible questions are arising in that particular chapter? and how we can write it down. So that concept I will deal in the 1 hour of my session, right? So in that we will go with the first point what is given. There is a school health services. So if you are talking about the concept of the school health services, so the question asking in that particular school health services in the different forms are possible. So there is a two areas. One is in the form of a theory examination, where in the theory paper, a possibility in the Viva examination. The Viva examination question under the heading of school health services, mainly they ask in the question related to the Viva, that is the furnitures in the school. So when they ask about the furniture in the school, we have the three furniture that is I already given. There is a minus desk, zero desk, and the plus desk. That should be the answer because that is one of the important Viva examination question in the school health services. Other than that particular question in the school health services, other can be asked for the exam. That is a Viva examination. So that may be in the form of a midday school meal. So how much calorie has to be provided in the midday school meal? So that may be the one of the Viva examination question. See, that is one of the area. So, and what is given in the left side? So, those are the questions can be asked for the theory examination, right? There is a health problems of the school children. So, that may be the examination question. Then for the 3 mark question, objectives of the school health service. That's once again for the 3 mark question. See, healthful school environment. There is an essay type question. There is a 5 mark question they can ask. So, I am dealing with that particular healthful school environment a little bit more because they are once they ask in an examination. Then school health services, in general, they can ask, right? When they ask in general, the school health service, you can write in short, right? So that is also I am dealing with that. Furniture of the school is so once again that important for the theory examination as well as the Viva examination. Midday school meal. See, so when you are talking about the word of the midday school meal, you should not be confused with the midday school meal and the midday meal program. See, midday meal program is totally different. Is an understanding from the midday school meal. If they ask about the midday school meal, you have to write the concept is explained in the school health services. Midday meal program that is in the form of the community nutritional program. And once they ask about the question related to the duties of the school medical officer for the 3 mark question. So I am highlighting these particular areas. So how we can write for the exam. So if they ask about the question related to the health problems of the school child, right? School child. See, this is an answer. This is answer. Generally, they'll ask for the 3 mark question. You go with a simple introduction for the health problems arising in the school child. See, that may be possible to vary from one place to another, and surveys done for the regarding with the different health problems. Then they given the description. They given the description. So you have to write these five as an answer for the health problems of the school child. School child. That includes the one is the malnutrition. Second one is the infectious diseases. Third one is the intestinal parasitis. The fourth one is the diseases of the skin, eye, and the ear. And the last one is the dental caries. See, these are the health problems which are arising, right? Arising from the school-going children. School-going children. Malnutrition. You can write the malnutrition. There's a protein energy malnutrition or the vitamin A deficiency disorder. So that you can be writing it down. The infectious diseases, the different categories of the infectious diseases. For example, the chickenpox or the measles. Those are the infectious diseases. The intestinal parasitis. That is very common. The children they are suffering with the intestinal parasitis. The diseases of the skin, eye, and the ear. So the earache or the eye problems or the skin, that may be the fungal infection, that particular point you write it down. And dental caries, that is very common. So this is the way you have to write for the 3 mark question. See, this is the question, it's not asking for an essay type or the 5 mark question. They'll ask for the 3 mark question. So this much has to be right for the exam. There is health problems of the school child. If you go to the next point, which may ask, I'm not saying it may be possible to ask, it may ask for an exam. There are objectives of the school health service, right? Objective for the school health service. If you remember, if they ask for the question for the school health service in an essay type question, then you have to start with this particular point. There is an objectives of the school health service, right? Objectives of the school health service. See, I make it in the red color, which has to be remembered for an exam point of its concern. One is health promotion, health protection, health restoration, health education, and healthy living. So that 5 points you have to remember, right? What is health promotion? The physically fit and mentally alert, that concept. Health promotion, the health protection from the various communicable and non-communicable diseases. Health restoration, how possible, early diagnosis, treatment, and follow-up of the defect. Health education related to the health consciousness in children and enacted the health habits and the practice. Healthy living, provision for the healthful environment. See, this is the answer you have to write for the objectives of the school health services. So that is about the second question which may be asked in an exam related to the school health services, right? See, this is one of the essay type question, right? This is a possibility of the essay type question they'll ask in an exam. That is aspects of the school health services, right? School health services. See, if you remember, if they ask for the essay type question of these category, there is an aspects of school health services. You have to remember all these points, right? All these points you have to remember. See, everything is comes under the category of an aspects of the school health services, right? From the health appraisal of the school children and school personnel, there is a 5 point. Second one is the remedial measures and the follow-up, prevention of the communicable diseases, the healthful school environment, nutritional services, first aid and the emergency care, mental health, dental health, eye health, health education, education and handicapped children, and proper maintenance and the use of the school health records. Right? So these are the points you have to remember for the exam point of view is concerned. Right? Exam point of view is concerned. If they ask for an essay type question, but maximally they ask the question in the final RGHS examination question, they ask the question related to the healthful school environment. They will ask for the 5 mark question. So I am dealing in detail of that particular. See, one more question they ask in an exam. There's a school children health checkup. You remember the question is asked is school children health checkup. In that you have to write about the first 2 points. That is helpful, the health appraisal of the school children and the school personnel, and the remedial measures and the follow-up. That answers you have to write for the question of the school children, the health checkup, right? So we'll go in short. I'm not dealing all those things, right? You see nutritional services, in that you have to write about the midday meal, the school meal, and then you have to go to the additional services that is available, right? So I'm not dealing with that particular point. You can write 2 or 3 points from the park book. You can note it down, then you can write for the next, not in detail, in short, but I will go with the detail related to healthful school environment, right? See, why I'm giving this particular slide, because once they ask about the health checkup of the school going children. So that is you have to write about this particular point. There is a health appraisal of the school children and the school personnel. So which covers, right? You make it into a bullet form, then you write it the answer. So it covers students, teacher, and the other school personnel. Periodic medical examination and observation of children is done by the class teacher. The periodic medical examination, school personnel examination, and a daily morning inspection, that comes under heading of this heading, right? So the periodic medical examination, in short, recommended medical exam children at the time of entry and thereafter every 4 years. School personnel, that is in the form of a teacher and other school personnel, their examination has to be done, because there is a possibility of the communicable disorder from them to the children. Last one is the daily morning inspection. Right? Daily morning inspection, the teacher carry out the daily inspection. See, this is the 1 point you have to write for the exam when they ask about the school children health checkup, right? So this is an idea. Right? This is an idea. See, this is the points I given about. This is very difficult to remember all those things which has to be right in the answer. You remember 3 or 4. You remember the 3 or 4. So that is enough for an exam. So which are the areas where there's a need of the school health checkup in detail? So these are some of the examples are given, right? It may be related to the skin condition, pain in the body, or the diarrhea, or the coughing, or sneezing, right? Any rash or the spot, unusual flushed face, chills or the fever, headache, red or watery eyes, right? The rigid neck, sore throat. See, these are some of the examples. See, these are the points you have to remember. So you can write it down in an exam. When these symptoms are present, you have to go for especially you have to go for note it down, and you have to be given the information to the school teacher, and then you have to be done the examination. So that is the way you have to write for the answer. So that is about the school children health checkup. The next important point, so we'll go with the healthful school environment. So once you are talking about healthful school environment, see, remember that will ask for the 5 mark question. So you write it down the introduction point, what is given in this particular, right? I'm not reading that one. I hope you can read that one. So that is considered to be the introduction part. Then you have to write about some of the points related to the healthful school environment. So that I will give in the coming slides. So that is you have to write. So this is an healthful school environment. How should be that, right? The building, how should be there? How should be the environment should be there? And why there is a need, right? You have to write that it's a need for emotional, social, and the personal health of the pupils, right? So that is as an introduction part for the healthful school environment. Remember, this will be asked for the 5 mark question. Generally, they'll ask for the 5 mark question. See, what are the points comes under that, right? What are the points which comes under that? The first point which comes under the particular is the location, right? So the location, so that is the point you have to write about, right? So there has to be from the distance, right? There has to be promptly the fence or keep from all the hazards, are centrally situated the proper approaches to the road. That is General idea related to the location. You write those. See, if you are not remember the points what you have to be write for the exam, at least you have to remember what is the side headings are given. See, that is the one of the side heading is the location. So that particular point. So best answer, how we can write the best answer for the health school environment is first you write all the side headings, then possible you go in explanation. So that is the best way of an answering, right? Next one is the site, right? Next one is the site, which is related to the healthful school environment. See the 10 acres of the land, you remember, for provide for the higher elementary school, 5 acres for the primary school with an additional 1 acre land for the 100 students. In the congested area, the preferred for the public parks as a preparation for the playground for the students. See, this is the gist. So that has to be right, not in detail. The gist you have to be right as the site is concerned. See, next one is the structure and the classroom. How should be the structure and how should be the classroom? So there is a side heading. You have to remember. See, the nursery and the secondary school, the single store. So there is the idea what they given. The exterior wall, how should be the thickness? Right? So 10 inches is thickness. Sometimes that will be asked as an Viva examination question. What should be the thickness of your the exterior wall? That's a 10 inches, right? Should be heat resistance. So that is about the structure. Classroom, right? Height should be the 12 feet. Generally, the classroom is then accommodate the 40 students, right? 40 students. Veranda should be attached to the classroom, right? The floor surface should be smooth so that it can be cleaning and washing. Good lighting and ventilation. Blackboard should not be the glare. See, you write it in the form of the bullet form, right? Bullet form. Don't write in the sentence form, right? Once the question is asked related to the helpful school environment, you make a bullet form in all the structures and all the side headings. Once you wrote the side heading, then you write it down in the form of a bullet form, right? So that's a pinpoint answer. Don't go for the other than the pinpoint answers. You go with the very pinpoint answers. See, furniture. So that is one of the important point, right? That is one of the important point. Generally, they'll ask for an exam, right? Generally, they'll ask for an exam for an Viva examination. I already told, and also the 3-mark question as an furniture in the school, right? Furniture in the school. So the furniture should suit with an age all group. See, remember the 3 types of the desk and the chair arrangement. So that you have to remember. Those are the 0 desk, plus desk, minus desk. Which one is? They'll ask the examination, right? Which desk is the best for the school going children or the school children? Your answer should be the minus desk, correct? Minus desk. Now, what is that 0 desk, plus desk, minus desk? You will see with the 2 vertical lines from the margin of the desk that touches the edge of the chair. Then it is the 0 desk. Plus desk means there is a space between the edge of the chair and the vertical line from the desk. Minor desk is the one where the chair can be pushed into the inside of that particular desk. That is a movable. It's a movable. There's a vertical line from the desk falls on the chair. So that is said to be the minus desk. And remember, there is a best desk for the school going children to avoid the back problem. See, this much has to be right for the school furniture. See, that is the inside one question. Helpful school environment. Inside that, you will get the one question that is in the form of an furniture in the school, right? Furniture in the school. That should be your answer. Your answer. So that is what you are talking about. That you are talking about. So 0 desk, minor desk, and the plus desk. It's a plus desk. So that is a concept. There is a concept you have to remember, right? Okay, next one is doors and the windows as a side heading and the color inside the room. That is also the side heading. The windows are broad with the bottom sill. That is a point you have to write. Height should be 2 to 6 feet from the floor level. Combined door and the window area should be 25% of the floor space. Window should be placed on the different walls for the cross ventilation. The ventilator should not be less than the 2% of the floor area. This much you have to write for the doors and the windows. Next one is a color. There is a periodically whitewash. Inside the color of the classroom should be the white. That much point is enough for the doors and the windows and for the color. Next side heading is the lighting, the water supply and eating facilities, right? Eating facilities, that should be the side heading. And you can write, see, there is not a very specific points to be described in the lighting or water supply or the eating facilities. You just, you get an idea what should be. See, lighting, when you're talking lighting, should be the natural lighting has to be there, right? Natural light should be there, has to be from the front. Water supply, independent source of the safe and the potable water supply has to be there. Should be a continuous, distributed from the taps. That is an answer. Eating facilities has to be an clearly, so the clear room has to be there, which has the maintenance of the hygiene. So that is a point. Lavatory and the clean sanitation is an additional point. An additional point has to be right for the healthful school environment. Healthful school environment. So this is about the points has to be remembered for the healthful school environment. From the area of the location, from the area of the location till the lavatory and the clean sanitation, that much point has to be right for an examination in the form of an healthful school environment. I hope people get the word. You can get the word of healthful school environment. So this much has we give the general introduction related to the healthful school environment. Then you go for the side headings. Once you write all the side headings, then one or point related to that side heading has to be right. So that much is enough for a 5 mark question if they ask for healthful school environment. If you remember, healthful school environment, if they ask for the 3 mark question, you write the introduction, only the side heading is enough. The side heading is enough if you write for the 3 mark question, 3 mark question. So that is about the healthful school environment. The one more question may ask for the 3 mark question, that is a midday school meal, right? Midday school meal. Especially they'll ask the Viva examination question. Viva examination question. What is the principle? Right? Principle is 1/3 of the daily calorie requirement. So that is your answer. And half of your daily protein requirement, half of the daily protein requirement that has to be supplied. So when the question is asked with the midday school meal in the form of an Viva examination, right? Viva examination. No need of explanation of all these, right? You remember the principle, that is 1/3 of the daily calorie requirement, and the second one is half of daily protein requirement of the child. So that point you have to remember. Then you possibly remember no profit, no loss has to be given for an appropriate meal for the children. So there is an attendance will be an appropriate. There have to giving a nourishment meal, right? At least the one nourishment meal, so on. So why there is the combat the malnutrition? That you can everything you can write it down. If they ask, right? If they you can ask answer like that when they even they ask in an exam, right? Why examination question, right? So that is the concept related to the midday school meal, right? Midday school meal. See, I have given some of the points related to the duties of the school medical officer. Why I am very specific? Because 1 or 2 times that is an asked in the RGHS university RGHS examination. There's the duties of the school medical officer for the 3 mark question. 3 mark question. So these are the some of the points. Right? These are some of the points. So I given about the 10 points. Right? The 10 or the 12 points I given. At least you have to remember the 6 points. Right? You have to remember the 6 or the 7 points. You have to write for the exam. Right? The duties of the school medical officer. If the question is asked the duties of the school medical officer, so this is the way you have to go for an answer, right? That's early detection and treatment defects in the children, avoid the strain and practical difficulty of an annual medical checkup, organize the preventive measures in case of an outbreaks, periodic immunization of the children, isolation and quarantine of the children suffering from the contagious disease, to guide the site of the school building, ventilation, lighting, hygienic cleanliness, sanitary condition. See, those are the answer, the points which are related to one to another. So you remember like that, so you can minimum possibility of the forgetting will be goes reduced, right? So if the person is having the outbreak, there is a positive immunization to do. You have to do the isolation and quarantine. So there is the duties of the school medical. The further regular periodical inspection of the school for the so this is the some of the area. So these are the some of the functional area of the school medical officer. Right? So maintain the medical records of children, instruct the teacher for a common ailments and training for the first aid and hygiene. So these are the points related. These are the points related to the functions of a school medical officer. School medical officer. Right? Okay. This is the point you have to remember for the first point. There is a school health services. Right? In that school health services, a possible questions which are asked in the university examination is one is the healthful school environment. So that is asked for the 5 mark question, or the objectives of the school health service. That may be the one more question they can ask in an exam, or else the health problems of the school children, right? School children. So that is how to write the answer. I already given the answer, right? Why your examination question is what is the plus desk, what is the minus desk, right? Minus desk, what is the zero desk, and which one is the best for the school going children? Answer should be the minus desk, right? Minus desk. So that is about the points related to the school health service, right? School health services, right? Okay, we will go with the next point. Next point, There is Apadravya Nivarana Vyavastha. There is a one terminology. Related to that is a refuse disposal method. Is a one more terminology. The one more terminology related to those two is solid waste disposal methods. Why I'm giving these three? Because in the university examination, all three the terminologies are came for an exam. Apadravya Nivarana Vyavastha or the refuse disposal methods or the solid waste disposal method, your answer should be the same. See, all these three areas, the answer will be the same, right? Answer will be the same. So I am saying all these terminologies. One is Apadravya Nivarana Vyavastha, refuse disposal methods, and the solid waste disposal method, solid waste disposal method. So these are the points. See, here also is a vast subject. It's very difficult to explain in a matter of 1 hour. I am focusing what are the possible questions in the theory, what are the possible questions in the Viva, and how we can write in an answer. So that we will go with that, right? See, what are the possible questions which can be asked in an exam? For an essay type, for the 10-mark question, a solid waste disposal methods. That can be the essay type question. For the 10-mark question, for 5 or the 3-mark question, they can ask composting method or control sanitary landfill or the source of refuse, source of the refuse. So that can be asked for the 5-mark question. 5-mark question. The solid waste disposal methods. As in the general question, that's a general question. They can ask for an essay type question, right? Now, if they ask the question related to the solid waste disposal methods, right? Now, what should be your answer, right? What should be answer? So that I will see, right? I will say that in that first you have to be go for it. First you have to be go for in the form of an definition. That should be your the first is definition. Then you have to write about the content of the refuse, right? Content of the refuse, health hazards due to the improper disposal, source of any refuse, and the methods of the disposal of the refuse. Those are the 6 types. You write one by one, then you give the description, right? Then you give the description, right? Okay, definition. The definition, what is the definition? It's an unwanted or the discarded waste material from the houses, street sweepings, commercial, industrial, and agricultural operation arising from man's activities. In the cities, it is called as a refuse, and in the countryside, that is the villages, it's called as the litter. It's called as litter. In the cities, it is called as a refuse. See, this is the definition. So that you have to be right for the answer, right? Unwanted or the discarded waste material from the houses, street sweepings, commercial, industrial, and agricultural operations arising from the man's activities. In the cities, it is called refuse, and the countryside, it's called as a litter. So that is the definition. Now, what are the contents of the refuse? Contents of the refuse, it may be the garbages, that the food waste, rubbish is the paper waste, or the plastics, wood, metal, throwaway containers, or the glasses, that everything is comes under the category of rubbish, demolished products, a sewage treatment residue, that is a sludge, or the coarse screening, dead animals, manure, dust, ashlight, and many other which are combustible or incombustible debris. So that is comes under a category of content of the refuse. So that is you should be write the answer, right? Now the health hazards due to the improper disposal, right? Improper disposal, that is organic materials ferment, and that will be go for the favor for the fly breedings. That's the first answer. Garbage attract the rodents and the vermins. Pathogens present in the refuse conveyed back into the food through the flies and the dust. Water and the soil pollutions are possibility. Risk of the air pollution is possible, right? And producing an unsightly appearance in the sink, right? So that is what you have to write for the health hazard, right? Health hazard due to an improper disposal. See, source of the refuse, right? The source of the refuse, they can ask separately for your exam. Right? They can ask separately for your exam, right? Exam for the 5-mark question, right? 5-mark question. Now, what are the source of the refuse? Right? Source of the refuse, you write the street refuse, then is the market refuse, then it is a stable refuse, right? The stable refuse. See, then you have to write about the industrial refuse, right? Industrial refuse. Then you have to write about the domestic refuse, right? Domestic refuse. That domestic refuse is consisting of the 3. One is the rubbish, garbage, and the ash, right? Rubbish, garbage, and the ash. Those has to be right. Those has to be right in the form of a source of a refuse, right? Source of the refuse. See, in that source of refuse, you can write what are the materials are possible, what are the content in that particular source of refuse. For example, if your industrial refuse, right, it may be in the form of the different categories of the chemicals. That may be, you can add your answer. You can the answer you can add. Street refuse, that may be in the form of the leaves or the straw which is collected in the street. Market refuse, there is a vegetables, there is an polluted vegetables or the animal dropping, that may be possible. A stable litter, right? A stable litter, that is in the form of collected stables which present in that particular stable. So those are the answers you have to be right. Those are the answers you have to write for the source of refuse, right? Now methods of the disposal. Method of disposal, we have the six: dumping, a controlled sanitary landfill. Third one is the incineration. Fourth one is the manure pit. Fourth one is the composting. Fifth one is the manure pit, and the last one is the burial. Last one is the burial. See, that much has to be right for the exam, right for the exam. See, if they ask about an individual, so now what has to be right in that, right? What you have to be right in that. See, remember, when you have to go for the individual, the method of the disposal, in that you have to write about what is that methodology, right? What is that methodology? How they follow that methodology, right? How they follow their methodology, where that will be applied, right? Where that will be indicated or applied. Then what is the advantages? What are the disadvantages? That much has to be right from dumping till the last point of in the form of an uh, the manure pit. So manure till that you have to write that particular answer. If you have the classification, for example, control sanitary landfill, you have the three methods, right? We have the trench method, we have the ramp method, and we have area method. You write it down. Why I'm going a little bit more detail, because two times they ask for an essay type question. There is a solid waste disposal method or the Apadravya Nirmulana Vyavastha. That question is asked in an exam. So I'm going little bit detail of this particular aspect, right? See, there is in the first one is the dumping, right? You have to write about the dumping. We have to write what is the dumping, that's what is the drawbacks that you have to write. A control tipping of the sanitary landfill is there. Then you have to write about what is the control tipping of the sanitary landfill. Those three methods, right? The trench method, ramp method, and area method, that you have to be write it down. The third one is in the form of an incineration. For which one is the best is an incineration? That is in the form of an hospital waste. It's the best for an incineration methodology. Incineration methodology that
Sorry for the interruption. There is a technical glitch. Sir will join within 5 minutes.
Okay, we'll come back. So because of net problem, we are erasing the issues related to that. Okay, we are discussing, right? So we are discussing we are discussing related with the how to have to write the answer, right? How we have to write for answer. You then ask about the disposal methodology of a solid waste, right? Solid waste. So in that the possibility is a composting, right? So we are discussing related with the composting. See, when you are talking about the composting, so there may be possibility of the two possibility way, right? One is the Bengaluru method, right? One is the Bengaluru method. One is the Bengaluru method. I hope my voice is audible, right?
Yes, sir, the voice is audible.
Yeah. The two possibility, right? One is the Bengaluru method and one more is in the form of a mechanical composting, right? See, when you are talking about the Bengaluru method, that is having a different way of go for the methodology, right? Methodology. See, possible I will convey my notes to your organizer so you can make use of that. In that I draw the diagram also, how we can go for a filling of that particular trench, everything. So that I will be make you arrangement for people. Next one is in the form of the mechanical composite, mechanical composting. See, when you go for the mechanical composting, you have to write the separate headings, right? With the scavenging procedure, then you have the pulverization procedure, then you have the incubation procedure. Last one is the composting methodology. Right? Composting methodology. Like that, you can write your answer. Right? Write your answer. So that is what they're talking about a composting method. It's a Bengaluru method as well as then composting, Bengaluru method composting as well as then the mechanical compound, mechanical composting, right? So these are the answers. This is one of the important, right? Important, maybe asked in an exam, right? Important, that is a composting method. Last two are the one is the manure pit and the burial. Some of the points are there highlighted. How we can follow that one? So that you have to be write even answer, write even answer. So those are the six methodologies, right? Now, what are the possible questions, right? Possible questions they can ask in the Viva exam, right? Viva examination that I noted here, right? I will give the answer for all those things, right? I will give the answer for all those things. See, garbage, right? What is the meaning of garbage? That is a Viva examination question. So the garbage, you remember the word when the garbage is come, it comes under heading of a food waste. Right? It comes under as a food food waste, which is one of the content in the domestic refuse. That is your answer, right? Now, the second possible Viva examination question is what is the content of a domestic refuse, right? Content of the domestic refuse. If they ask about the content of the domestic refuse, right? Domestic refuse, your answer should be it is having the three possibility. One is the rubbish, second one is the garbage, and the third one is the ash. That is your answer. Only that much. Don't give an additional information. Right? They ask the question, what is the content of the domestic refuse in an exam? You say the rubbish, garbage, and ash, right? Third possible Vayu examination question in the Apadravya Nirmulana Vyavastha is What is stable litter? See, stable litter is one of the source of refuse, where the stable, which is collected, the litter, that is the refuse, is collected from the stable, where the animal droppings and the food waste, leftover animal food, are the possible content. So that is our answer, right? Next possible Y examiner question is, what is rubbish? There is a paper waste, or the plastic, or wood waste, or the metal, or the throwaway containers, or the glasses. They come under heading of a rubbish. That's the one your answer, right? Next one is important, is the way examination question is, what is dustless refuse collector? Right? So the dustless refuse collector, that is the vehicle which is completely closed, right? Completely closed, and carries the refuse, right? Carries the refuse from the site of production till the area of final disposal. So that is known as dustless refuse collector. See, that is YV examination question. What is dustless refuse collector? So once again, I will say, it's a vehicle which is completely closed and carries the refuse from the area of production till the area of final disposal is known as dustless refuse collector. Dustless refuse collector. That is the one. One more way. Regularly asking question. Right? Regularly asking question in the YV examination. That is, what is modified sanitary landfill? Right? Modified sanitary landfill. The answer is, it is one of the methodology in the control tipping or the sanitary landfill, in which compaction and covering of the refuse is accomplished once or twice in a week. Once again, I'll say, it is a method of control tipping in which compaction and covering are accomplished in once or twice in a week, is refers to the modified sanitary landfill. So that is YB examination question. One more YB examination question is, what is ramp method? See, ramp method is comes under the category of the controlled sanitary landfill, where the slopy areas are there, where they're making the depression and the elevation. In the depression, there is a putting of the refuse, and closing that refuse by the elevated areas is known as a ramp method. See, those are the YY examination questions. After my 12 years of teaching experience, so these are the questions which are asked by the external during the examination. So that is I am putting over here. One more YY examination question is the made soil. Right? What is made soil? Right? Made soil. See, made soil is useful in the area method. Area method. The meaning of the made soil means the naturally depressed area, if the mud is added and make it to a compact, that particular compacted area is known as made soil. Once again, I'll say, if the depressions are there, the big depression, natural depression, to that there is a putting of the mud or the mud and make it into a compact, and that particular area is made soil. What is the significance is, made soil is not used for the construction point of view. That point you have to remember. Made soils are not used for the construction point of view. The next one you examine question is, tipping of the refuse in the water is correct or wrong? Your answer is wrong. Hospital refuse disposal method. What is the best method for hospital refuse disposal method? That's why you examine the question. Your answer is incineration. See, types of the composting is a one more question. The two types of the composting, one is the Bengaluru method, and one more is a mechanical composting method. Bengaluru method, it is also known as a hot fermentation process. Mechanical composting is also known as an aerobic method. That you have to say the answer. Steps in mechanical composting, I already told. Four steps. First is the scavenging, second one is the pulverization, third one is the incubation, and fourth one is the composting. So that is the what is the steps in mechanical composting. See, one more question they can ask is, method used in the small camps for the refuse disposal. Your answer is, there should be in the form of a burial method, right? Burial method. Burial method. The one more way examine question they can ask me is, what is the method is used for the refuse disposal in the villages? Your answer should be the manure pits, right? Manure pits. So that is your answer. The one more question which may be possible to ask in the bio examination in the solid waste disposal method or is Apadravya Nirmulana Vyavastha is depth of the layers in the Bengaluru method. If you want to know the depth of the layers in the Bengaluru method, you have to know that in the Bengaluru method, sludge and the refuse, they will go for an alternative method. Alternative method. First layer is refuse of a 15 centimeter, then it's the night soil of the 5 centimeter, then is the refuse, then it is the sludge like that, topmost area, topmost 25 centimeter should be the refuse, should be the refuse. So that you have to be remember, that you have to be remember. So that is the Viva examination question. These are the some of the Viva examination questions, or the questions may be related to it. Questions may be related to, which is asked for an essay type question, right? Essay type question. But for an exam point of view is concerned, for an exam point of view is concerned, the fuse disposal methods, or else the solid waste disposal method or Apadravya Nirmulana Vyavastha is important. So you should not be skip this particular syllabus when you go for reading. So these are some of the questions I told. So these are possible to ask in the Viva examination. And the essay, what are the possible essay type question you already told in the previous slides. So on that way, you can go for an writing the answer for the solid waste disposal methods, or else Apadravya Nirmulana Vyavastha, or else refuse disposal method. See, all three, the question will, the answer will be the same, right? So the one more point what is given to me. So the discuss in the form of for an exam part of non-communicable disease, right? Not so much important. Clearly say that this is not so much important, but sometimes they'll ask, what is the risk factor for an obesity? What are the risk factor for a diabetes mellitus? What is the pathya and apatya is for use for an obesity, or pathya and apatya may be an obesity, or the diabetes mellitus pramaya. See, the concept of the pathya and apatya maybe also comes in ahara also, right? Non-communicable disease, right? Non-communicable disease, you remember, one is an obesity, next one is a hypertension, right? Hypertension, then in the form of an cerebrovascular accidents, then in the cancer, right? Cancer, then we said the coronary artery disease, coronary heart diseases. These are the non-communicable diseases in your syllabus point, or the lifestyle disorders. In that you remember what is the non-communicable disease. You have to remember. Then what are the risk factors? Only that much you have to remember, because till now only the one time they ask about what is non-communicable disease. That's all. After that they are not asking any further questions related to that. So I am not going in detail of that particular non-communicable diseases, but you give the more concentration for the previous two aspects. One is school health services, and one more is solid waste disposal method, or else refuse disposal method. So this is about the 3 points. And 3 points. See, these are the questions. These are the questions which are asked till now. Right? Asked till now related to what I am discussing. The three syllabus points: right? School health services, non-communicable diseases, as well as in the form of an the solid waste disposal method, right? The question is elaborate control tipping. So that is asked for the 5-mark question in an exam. I already told how we can write the answer. For example, if they ask to elaborate the control tipping, you given the description is, it comes under the heading of refuse disposal method. In that it comes under heading of a control tipping. Right? Control tipping. The control tipping will be the 3 method. One is the trench method. Next one is the ramp method. Next one is the area method. Then you have to write after the description of those 3. Then you have to write about what is the possible after the disposal. You write when there is an, he says, you have to say about this will be converted into a manure. Convert to manure within a matter of 4 to 6 months. So that should be your answer. That should be your answer for 5-mark question. The one more question that asked in an exam. Furniture in the school. I given in detail. Furniture in the school is a 3 types: zero desk, plus desk, and a minor desk. In that minor desk is the best one. Next, related to the non-communicable diseases, describe the pathya and apatya for an obesity. That asks for the 5-mark question. In that you can, right? I can give the one idea, right? Pathya and apatya, when they ask about pathya and apatya, you can write the 2. One is ahara, pathya and apatya, vihara, pathya and apatya. In the ahara, you classify it on the basis of a varga, right? Which is indicated content in Shukadhanya varga, Chimbidhanya varga. Like that you can make, don't simply write the pathya and apatya in together, right? You make a column, right? You make a column which has to be done in the form of Shukadhanya, Chimbidhanya, Harita Varga, Gorasa Varga. Like that, you can give the description, right? Risk factor for the diabetes mellitus. That is one more. The question is asked for the 3-mark question. See, the solid waste disposal, they ask for the 5-mark question 3 times. So I'm saying that it's an important for the exam, right? School health checkup. I given the description, right? You have to write about the 2 points. Right? 2 points. One is the school personnel, their health checkup, and when you have to do that, we have the 3 point in that. Then you have to go for the remedial measures. Right? Remedial measures, that is the second point in the school health services. That description you have to be given, right? That is for the 5-mark question they ask once in the exam. Duties of the school medical officer. What you have to write, I already given in the slides. Non-communicable diseases. They ask for the 3-mark question. What you have to write, I given the description in the previous slide, right? Then essay type question they ask about for the Apadravya Nirmulana, right? There's a terminology which is used is Apadravya Nirmulana, the right about the methods of Apadravya Nirmulana, that is solid waste disposal. They ask for the 10-mark question. So 10-mark question. Okay, this is the a concept in short, right? I'm not talking about that is in detail. This is the in short how we can prepare for an examination related to the school health services, the Apadravya Nivarana Vyavastha, or the solid waste disposal, or else refuse disposal method, as well as the non-communicable diseases, non-communicable diseases, right? Okay, this is my perspective related to those three. How we can you people can go for an a preparation for an RGHS or the final the university examination, right? Okay, thank you. Any question or
So,
anything is there? You can ask.
So our session ends here. If anyone have doubts, please do drop your comments here. And once again, I thank Yogesh sir for the valuable and the useful lecture. Thank you, sir.
Okay, thank you.
Thank you, sir. This class or the session, our session will be uploaded in the Panchajanya YouTube channel. If you all have any doubt, please drop your comments. Thank you so much, sir.
Okay, thank you. I can leave, right?
Yes, sir.
Yeah.
Thank you, sir. Yeah.
Okay.